realised that our quality improvement system, our QIS system, was definitely here to stay. We had complete buy-in from the board. This was a long-term commitment for us. We'd already done a lot of awareness sessions with key staff. We'd had a lot of improvement events, so via those improvement events, staff were being exposed to methodology. But actually, when we got to this point in our journey, we actually realised we needed to do much more than that, and it needed to be much more than just awareness raising. And we needed to be actually teaching others those practical tools to be able to use them themselves and to obviously benefit our service users. And again, this has already been mentioned more than once. We have to also reinforce it's not just a set of tools, it's that mindset, that change of mindset and a philosophy to ensure that we're improving constantly. We ask the staff to come along with a project of their own, so it's something within their own remit, their own work area. So they're not only benefiting from the training, but they're actually applying it in their own work area, so they actually get the benefits from that as well. And again, you mentioned as well, Chris, keep it small, keep it manageable. You know, you're being taught in the methodology, but also we want you to have some outcomes, so keep it manageable. One of the key things that we said from the very beginning was we didn't want us as a KPO team to be going in and have the sole responsibility for delivering this training, because then it would be seen as something that's the KPO delivering. So I've talked about these certified leads that we have across the organisation who are at a very senior level. And so they actually sponsor and mentor each of the individuals on this leader programme. This is just a sort of a split of each of our localities or services. The blue is the 2011 training, but basically what it's saying is, in summary, we've trained to date about 153 QIS for leaders across the organisation. We've got about 40 in training currently, with a bit of a waiting list, dare I say. I hate to say that, we're doing a bit of a waiting list because people have found it so popular, and then word of mouth, other people want to join. But the two key things that were developed was another two training programmes, which I'm going to talk about, which was the first one is quality improvement system for medics. And I'm sure nobody will disagree. If you can engage your medics in the organisation in whatever it is that you're trying to do, then you're onto a winner. So very early on, our clinical director, actually we have a clinical director who sits within the KPO team, said that she wanted to make it mandatory for all of our medics, our consultants and our specialist doctors must actually attend training. The other group of staff that we felt were absolutely fundamental to engage in our quality improvement system training is our admin staff. They are so fantastic. And my first 5 years in the NHS was a medical secretary, so I do have a bit of an affinity with our admin staff. And whenever they were on our improvement events and taking part in improvement events, the ideas that they came up with, because I think they're one group of staff that really know the process right the way through. So this was a pared down version of the quality improvement system for leaders training, much shorter, 7 of the 21 modules, but key things that we felt would help them. And what we're thinking about now is thinking about healthcare assistants, our estates and facilities, and trying to get some bespoke training for those people as well to encourage them. So it doesn't become this exclusive club, so it's very inclusive so everybody can be involved. I think that might be the end.